From Paris, France, you're watching CardioSource video news coverage of ESC 2011.
Hello, I'm Tony DeMaria, the editor of JACC, here at the European Society of Cardiology meeting, where we're reviewing the highlights, particularly the late-breaking clinical trials presented at this meeting. And I'm here with Dr. Spencer King, who really needs no introduction. I guess one of the studies that attracted some attention, Spencer, was the examination trial.
Yeah, that was one of the late-breaking trials. It's a trial of acute myocardial infarction, really looking at the question of whether drug-eluting stents do better than bare metal stents, and so it used the most modern, the highest use drug-eluting stent compared to a platform of similar bare metal stent. And what it showed was the expected, that is, there was a reduction in target vessel revascularization as expected, without any real difference in mortality or recurrent infarction or late thrombosis. Late thrombosis actually was a little higher in the bare metal stent than the drug-eluting, so this is encouraging. And the magnitude of reduction in target vessel revascularization was in direction of the Horizon AMI trial that we know before. You prevent about 4 reinterventions per 100 that you do by using drug-eluting.
Yeah, it's really interesting because there's already a fair amount of data on the value and acceptability of using drug-eluting stents in patients with acute myocardial infarction. So in this examination trial, the pitch was that it was tested in a group of individuals that were unselected coming to the catheterization laboratory. So there's a trend I see, Spencer, of trying to get studies that are randomized but resembling the registries, try to be more real world rather than have very strict entrance criteria.
Yeah, I think so. They're all acute infarction patients, but as you say, they were the whole series of real-world patients with acute infarction.
Right. Now, in continuing with the number of studies that we've seen dealing with new antithrombotic agents, there's a factor 10A drug, Direxaban, and it was really a dose-ranging study called the RUBY-1 trial. It was a dose-ranging study for Direxaban in patients with acute myocardial infarction, or at least ACS. And in fact, as opposed to the other antithrombotic studies that we've seen with Rivaroxaban, Apixaban, here they weren't looking at atrial fibrillation. They were looking at patients with ACS. And there really was not powered for efficacy, and there was the anticipated increase in bleeding. So as I looked at it, I really wondered, given the fact that they were unable to show efficacy in this group, admittedly underpowered, and they did show a fair increase in bleeding, if ACS was going to be a fertile ground for these new agents.
Well, the increase in bleeding was dose-related, which raises the question about whether further investigation with a low dose would be of any benefit. But that you're absolutely right. It was a negative trial in terms of any efficacy, which couldn't be measured, but predictably increased bleeding.
Yeah, and the other stent trial was the BERN Rotterdam Registry. Again, a rather large registry looking at the newest generation drug-eluting stents, the Zion stent.
Yeah, so the everolimus stent was question. The question is late stent very late stent thrombosis. This is what's been raised. This is the great concern in interventional cardiology. And so what they did, they compared series of patients with sirolimus stent, with paclitaxel stent, and with everolimus stent. And the good news is that the everolimus stent had less very late stent thrombosis than either of the earlier generation stents, which shows progress in stent design and function.
Yeah, well, there's increasing studies that we've witnessed at this particular meeting, and I guess it raises the question, Spencer, is this stent technology continuing to evolve? What might we see in the future?
Yeah, maybe we're there with a commodity for the metal stents. I mean, we've done a great deal. We've gotten this very thin stents, and we've got effective outcome. It's interesting, though, when there was a study yesterday from the Japanese group that showed a rather equivalent outcome of the very early stent, namely the sirolimus-eluting stent, compared to the very modern stent. Similar in terms of late restenosis and all that kind of thing. The one encouraging thing is that in addition to being more deliverable, the newer stents, as they fine-tune this, have very low late stent thrombosis, which might change our ideas about what we have to do to prevent late stent thrombosis with the latest versions.
Yeah, well, the impression of a non-interventionalist is that stent technology has gotten so good that it's tending to plateau, and it may be very difficult to improve it too much in the future. We'll have to see. We'll be back in a moment.